All right, we're back.
Okay.
All right, good evening, good afternoon, and good morning to those of you who are joining us from across the world today for another edition of Pandemic Punditry brought to you by the Content Experience Company. We are delighted and honored to have with us Dr. Manik Hiranandani, or Doc Manik as we all call him, a renowned functional medicine physician noted for providing individualized, patient-centered, science-based approach to healing that empowers patients to address the underlying causes of disease and promote optimal wellness. Welcome to Pandemic Punditry, Dr. Manik.
Okay, thank you.
So a little bit of I have to be honest. Dr. Manik is also a longtime physician to me and my family. So we do know him personally, and he's singularly responsible for saving my wife's life and then mine as well. So we owe Dr. Manik personally a lot, but we want to sort of share his expertise of nearly 40 years as a physician with our viewing audience. And Dr. Manik is a very interesting personality. So we're going to get to know Dr. Manik very well here, hopefully, in the next hour. Encourage our listeners and viewers to send in their questions on either YouTube or Facebook or LinkedIn, and we will field those questions for Dr. Manik. So Dr. Manik, you are a classically trained, board-certified physician with additional training in cardiology and internal medicine. Is that correct?
That's right.
And you also are highly trained and expert acupuncturist that ran a much sought after acupuncture clinic in Hong Kong. You also wrote a book on laser acupuncture. And in addition to acupuncture, you have mastered several other healing techniques and technologies. What was the genesis of this quest to become an expert practitioner, not of just one modality of healing, but many different forms and types of medicine? What was the genesis of that, Doc?
I went into this field to help people. Okay. And I found that using the techniques I learned first, they were helpful, but they were not the full answer. So I started to look what are the other tools I can use to help my patients to get well. I discovered that a lot of treatments which I had been trained to do were purely symptomatic treatments. So even though we were helping the patient's symptoms, we were not really tackling the causes. So as a result, a lot of my patients would keep coming back to see me with the same issues. And I went back to the scientific medicine I learned as a student, which was always look for the cause. And I found that if I was able to find the cause and I was able to tackle the cause either with my own efforts or with the efforts of the patient, with change in diet, lifestyle, exercise, we were likely to get a permanent improvement in the state of health. Now, every system of medicine I looked at had its strengths. Every system of medicine also had its weaknesses. Now, for example, if we look at allopathic medicine, we have a lot of very powerful drugs to treat pain. But most of the time, we don't find and treat the cause of the pain. So people then wind up taking the painkillers for a long, long time. But if you can find what is the cause of the pain, we can often resolve the cause and the pain goes away. Because pain in itself is not the problem. Pain is the warning sign the body is screaming for help. So what we need to do is to figure out how and why a person has a problem. And from that, the answers flow. Now, every system of medicine has its strong points, has its weak points, and has its blind spots. Now, I found with purely allopathic medicine, there were a lot of blind spots in the story. And when I started to explore other systems of medicine, I found that each area had strong and weak areas. And by being able to actually figure out what were the strong and weak areas, I was able to put together a combination of things which could help a large number of my patients to get well and stay well. Since the objective is to help, I don't think it really makes any difference at all which is the tool you use. You choose what is most appropriate for each person. and one goes like that.
And Doc, you personally call this approach that you're using sort of integrated medicine, or what I think the West now has come to call functional medicine, right? In
Yeah,
some
that's
sense,
right.
which is
Absolutely.
sort of, pick the sort of the things that work, treat the human body as a whole, as opposed to. And I know you're a classically trained cardiologist, and you refuse to sort of even put that up there, because you assume that people only come for you for heart problems, when in fact, you treat the whole body as an entity, right? So Karthik, I know you're itching to get in a question there, so go ahead.
Yeah, thanks, Laurie. I must apologize though in advance if I seem a bit out of it. I got vaccinated today, so I'm a
Okay.
weeny bit sleepy. um, Thanks for joining us today, Dr. Manik. Could you share some of the amazing cures and remedies you were able to facilitate with acupuncture, for example?
Okay. Okay, see. Okay, acupuncture is a very powerful system of medicine which has been practiced both in India, in Sri Lanka, in China, and in a lot of the eastern parts of the world. Now, it is something which involves the use of very few drugs and involves stimulating energy points in the body. And now, actually, only last week I saw a lady who I first saw in 1999. She was just about able to see. If you waved a hand in front, she could see there was something over there in movement. But when you looked at it, she was hardly able to function. So when I looked at her, I looked in her eyes firstly. I do what is called iridology. And I figured out she had a milk allergy, which was causing her to get an illness called retinitis pigmentosa, which was affecting the vision. And after I changed her diet, and after about 3-4 months, I told her, please come back. We did some acupuncture. And her eyesight gradually started to improve. And by about, I think, 2002, she was able to see enough to manage. She was able to do her housework. She was able to do a great many things. And I've been treating her every year now for about 8 or 10 times over the last 20 to 22 years. And we did a fresh uh, perimetry, which actually maps out the visual fields. And even 22 years later, after she had been told she would be blind, she's still able to see, to function, and to read. Okay, now retinitis pigmentosa is an example of something where allopathic medicine is not able to offer any answers. And most people with this are condemned to be blind. But it was quite satisfying to look at this lady that over 22 years, she's actually managed to maintain her quality of life and vision.
Wow, that's pretty amazing, Dr. Manik. Could you tell us a bit about craniosacral or osteopathy, please?
Osteopathy, okay. Now, the thing is that in the body, we have got 206 bones. These bones articulate with other bones at a joint. Now, wherever you have a joint, that area is not as strong as an intact bone. So, whenever you have any accidents or falls, you can get a displacement at a joint. In the brain, uh, you have a coating around it of fluid, which protects the brain from injuries. And outside that coating of fluid, there are layers, and there's a big layer of bone there, which is called the skull. We have 29 bones in the skull, which each articulate at a joint. Now, conventional allopathic medicine seems to think that there is no movement which takes place at these joints. But it is the movements of these joints which move in and out like this, which circulate the cerebrospinal fluid. Now, a lot of problems which people face can be due to displacement of these bones, a lot of back pain which people have, a lot of joint pains which people have are a result of displacement of bones. So, craniosacral therapy is a way to replace these bones into the proper alignment. in a way that they move in the normal and natural way. So this can be quite useful in quite a lot of things.
So, Doc, when you say 29 bones in the skull, I think that's one of those first sort of things where the penny drops, right? People usually think of a skull as a solid, helmet-like thing that protects your brain. And very few people understand that there's 29 bones, and it's actually an articulating joint, right? That's another sort of a revelation that you just made. Karthika and I were always curious. I think, if that brain, I guess, has an impact of some kind, or all these joints, I guess the joint or these bones could move, right? And that could be
Absolutely.
a cause for ill health.
No, the truth is, my friend, they do move.
Okay.
If they stop moving, your brain will slow down, because it is the fluctuation and movement of these bones which takes place every half a minute or so, which circulates the cerebrospinal fluid, which gives nutrition to your brain. So, in the absence of this movement, you will find that you will be slow, sluggish, unable to think, etc.
Okay.
So that movement is essential for brain health. It is essential for normal function.
Okay, I'm gonna ask like a really, really stupid question. Like, I think it's really stupid, but I don't know. You tell me. So, with people who have autism or any of those other disabilities, does that also mean that those brains, like those joints, are moving differently or not moving at the right speed? Or
Okay, there can be quite a lot of causes for all of these conditions. Like autism has a lot to do with heavy metals, but it can also be due to displacement of the bones or a lack of free movement at the joints. Okay, all of these can be there. Because what happens is, unfortunately, we look at groups of symptoms. Like autism is a group of symptoms, but these symptoms can have quite a lot of underlying causes, and any effective treatment lies in first identifying the cause and then finding a way to sort it out.
Okay, so Doc, if you were that's an interesting sort of observation also, right? So that people take these diagnoses that people give, doctors usually give them, and say your kid's autistic, right? And the implication there is that you did some tests or something like that, and there's a definitive thing. And what you're suggesting is that this is a combination of different symptoms in varying degrees, and that there's for the lack of any further understanding or investigation, they give a diagnosis and say it's autism. And I think it sort of goes back to your genesis question that I asked earlier. So if you track each symptom independently, they could have various causes, and I think that's what you do. That seems to be different from maybe other doctors, where you go after each of the symptoms and see whether there's a heavy metal impact, whether there's a sacrocranial impact from an injury or from a birth defect or at the process of birthing, and then you sort of tackle each of those probable causes to see whether autism is actually there as a sort of, or is that some underlying different cause? Am I explaining a very complex process?
Now, what I'm going to tell you is, I'm going to tell you a secret. Okay. Every human being is individual and unique in their own way. So the same symptom in 20 people can have 20 different causes and 20 different answers. Unfortunately, the way that our mind functions is that we like to group things, so we need to stop thinking about it. Now, if you give somebody a diagnosis of autism, it means that he has a label and nobody needs to think about it. Why? I personally don't like to give a label to anything. I like to leave the matter open, and I like to look for the causes which contribute to a problem. And the contributory causes to any problem can be multiple. They don't have to be a single cause. Each cause may be contributing 5%, 10%, and occasionally even 50%. But in my experience of treating, thousands of patients over the years, I do find that the state of health with which people generally come to me has got multiple causes, each of which has contributed somewhat to the story with which they come.
Yeah,
Okay.
I think a lot of people can relate to that. I think we all seek a label because we want to sort of say what we have, right? Instead of saying, well, we got this, a little bit of that, 5% of this and 10% of that is not something we usually talk about, right? So people want to say, yeah, I'm Y, or I'm X, I'm not 5% of this and 3% of that. That's a very valuable comment. So Dr. Manik, in the nearly sort of 40 years of clinical experience you've had both in India and around the world, I'm sure you've come across like many interesting and sort of fascinating cases of illness. Can you share a list of ailments that people might not readily and easily associate with a dietary cause, like gluten or dairy, or as you mentioned earlier, heavy metals from pesticides and air pollution?
Okay. I'm going to tell you one more secret. Every person I see is really interesting. Okay, they're like a jigsaw puzzle. One has to put together all the pieces to figure out as to what is the cause. Okay, so for example, uh, I treated somebody who had been diagnosed with rheumatoid arthritis and also had a genetic thing which is called the Down syndrome. Okay. When I first saw the young lady, she was in tremendous pain everywhere, and and her parents were looking, can we find an institution to look after her, uh, because she was too hard to look after, right? And when I looked at her, I found that actually she had heavy metal poisoning. She was suffering from the effects of the drugs she had. She had a dairy allergy as well. And also, she also had a lot of injuries to the head, which stopped her from functioning normally. She was irritable, she was angry, she was not able to sleep well. All these things were happening. But when I sat and I listened to the girl for about half an hour, half the story became clear just by listening to her. And as we worked on her over the next 2, 3, 4 years, she became extremely high functioning. If you look at the photographs and the art she is doing now, nobody will say that this child has anything the problem with her. Okay, she still has the genetic features, but she's functioning and holding her own in the society in which she lives. When I started with her, she was about 6 or 7 years old. She's now coming on to 18 years old. And her life and the life of her family have changed by looking at the causes, being able.
Did we lose Dr. Manik there for a second?
Seems like we've lost him for more than a second.
Okay. He probably will come back up.
Hopefully.
Yeah. So Karthika, one of the questions that I wanted to ask Dr. Manik, I think he's back.
Do you wanna? Should we maybe chat to him and say?
Yeah, I think it's just probably. I think his location has sort of intermittent coverage sometimes. Just give him a second.
He might not have realized he's frozen.
Oh, okay. You want me to call him?
I dropped. Yes, please, if you can.
Okay. All right. Let me just go on mute.
Yeah.
Okay, that's the power went off in his building. That's why he said give him a minute or two. So, Karthik, is a really fascinating conversation. One of the things that I wanted to explore with that question I just asked Dr. Manik was, because I think that people associate sort of food and allergy issues for some common things like I'm lactose intolerant, that gives me gas. But I think Dr. Manik in his practice has discovered that some of the impacts from obviously this example that he just used, the milk allergy impacting the cognitive function of this young girl he was talking about. I think there are some other interesting sort of cases where what you eat seems to have a significant impact on your health, and I think that's what I was looking for in this answer. So we can probably revisit that with Dr. Manik. So Karthika, I think we also had some other questions we wanted to ask him about some of the other technologies and techniques he used. I think he mentioned Iridology. I think you might want to follow up and ask him what that is, because he did mention that. So maybe for the benefit of our listeners. And for those of you who are viewing and listening today, if there are any questions you would like to ask Dr. Manik in particular, please go ahead and send those across to us on whatever channel that you're watching us on. And we will have Dr. Manik respond to them when we get the chance. So go ahead and please send those across to us. And if you mind staying on for a little bit, he lost his power in his facility, and that's why we momentarily have lost him. So
the whole thing about autism was really interesting. He's back.
Yeah, it was. I think we have Dr. Manik back. Hi, Doc. Welcome back.
Hi, thank you.
Your volume is a little low, but maybe your distance from the mic.
Actually, I have a mic.
No, you're fine. You're fine now.
I have a mic. Okay, fine.
Yeah. So, Doc, we were sort of prompting you to give us a little bit more information around. I think people sort of associate dairy allergies or lactose intolerance with flatulence, right?
Yeah, right.
But I think in your long practice, you've sort of discerned impacts of sort of diet on a wide-ranging milieu of disease or ill health. It would be interesting for sort of our listeners to sort of understand some of the sort of more insidious things that food can do to your health. If you can share some of those anecdotes, that'll be great.
Okay. So the thing is that food is the basic thing in the body for you. So whatever you eat has an effect on you. The effect can be good or the effect can be bad. Now, the food which is good for a person may not be good for somebody else. So, for example, if you're a Brahmin from India who's been vegetarian in your families for centuries, if you start eating meat,
Did we lose Dr. Manik again?
Looks that way.
I think we have his audio is up this time.
No, it's not.
Not. Let's see whether it's the power.
Oh my God.
Yeah, might be. So appreciate everybody's patience. I think Dr. Manik's having some challenges with the power today. We are coming from India, so there's some in parts of Kerala where Doctor is from. There are some frequent fluctuations in power. So appreciate everybody hanging on and maybe formulating a few questions. Okay, we have one from Anurag.
And one
so
from
I think Doc is back. Yeah.
No, he's not yet.
Yeah, he should be back shortly. So that's a good question we have on bird flu. Yeah. Okay, so we can ask him that question when he comes back. Karthika, we've also going to ask the doc about some issues related to some of the misdiagnoses that he's seen right in his practice, commonly seen misdiagnosis by other doctors. I think he's back. Hi, Doc.
Okay, so sorry. Okay, we have quite a storm going on here at the
Oh,
moment.
okay.
So
Okay.
I think every
That,
time there's
that
a little bit of stuff, it seems to be going off. Sorry for that.
Okay, all right. I think we have a very patient audience who are very keen to sort of ask you questions. So, doctor, based on my previous question, what are the more insidious sort of, reactions to from impacts on diet, right? Gluten, dairy, whatever else. Oops. All right. Is it raining in Colombo, Karthika?
Yes, we have a lot of rain here actually
Okay, all right.
at the moment. Okay.
All right, doc. So, if you could answer that question, that'd be great.
Okay. So food has a different effect on different people, and the effect tends to vary upon the quality of the food also. Now, if you have a food allergy, the effects on you can be quite different according to what is going on with you exactly. So, if you have a gluten allergy, for example, it can cause anything from loose motions, diarrhea, constipation, pain in the body, even things like multiple sclerosis, different types of tumors, different types of cancers are also associated with gluten allergies. The same applies to things with milk. Milk is a very common cause of autoimmune illnesses. A lot of autoimmune illnesses like rheumatoid arthritis, asthma, scleroderma, etc., uh, lupus erythemosis, all of these are autoimmune diseases which can be associated with allergies to dairy or to gluten. Now, the effect on food tends to vary with each individual because each individual is unique in their own right. There are some people for whom a vegetarian diet is ideal, and there are some for whom a vegetarian diet is not ideal, really. So, what we need to do is to look at diet in the context of each individual instead of as a group to generalize the story. I see we have some questions from the audience also. Just one second, let me switch on this light. Yeah.
Yeah, so there's a few interesting questions up there from the audience, doc.
Okay, so
One
we've
about
got
a regular head massage, I think.
massager. Okay. I do not advise the head massages for anybody. If you're doing a head massage, please do it yourself and do it very gently. The way that some of the people do the head massage is too hard and violent and can create abnormalities of the skull bones and abnormalities of brain function. So, for Tanjana, anyway, if you want to massage your head, please do it yourself. Okay, and very gently and very softly. I would not advise that you go out and get people to do stuff on your head. Okay, somebody is asking, is it wise to take COVID vaccine? Okay, Sharad, the thing is that you have to see, are you at high risk? If you're going out and you're meeting a lot of people, then you are at high risk and it may be worthwhile to take the risk. I personally feel that there's not enough information available on both the side effects and the efficacy of the vaccines from any independent source as yet. All the vaccines available worldwide seem to have got emergency use authorization on the basis of very little clinical information and research. I think now that the vaccinations have been going on for 3-4 months in various countries, we should by April or May have a little bit more solid information as to the efficacy and the side effects of the vaccine. At the moment, I don't think there's enough information to really make a choice on it.
Good
And I
answer.
and I think somebody else also asked that the sounds in the ear.
Yeah.
Okay, now sounds in the ear mean that there is a pressure, usually on the auditory nerve or on the hearing apparatus inside the ear. It can also be a side effect of various kinds of drugs which have been used. So, the treatment for that lies in trying to identify the cause of the sounds in the ear and see if it is something which you can sort out. Now, it can often be a side effect of some of the drugs which are used, and to clear them out once the nerve has been affected is not very easy. It can be done over some years, but it needs quite a lot of effort and changes. If it is due to pressure on the nerve, then craniosacral therapy and acupuncture are both things which can be helpful for that. It is often also due to infections in the ear and in the mastoid bone, which lies at the back of the ear. So if you have a ear infection, the first thing would be to start taking steam inhalations at least 5-6 times a day to be able to clear the infection. And I have seen in quite a lot of my patients who have had ear infections that just taking steam 5-6 times a day usually starts to give them improvement in 3 to 4 months and probably clears up in about 18 months to 2 years.
Karthika, you had some questions?
Yeah.
One more audience question.
Yeah, one more audience question.
I
How
guess
do we
Anurag is asking, how do we tackle precautions while consuming poultry and eggs in wake of bird flu in India? Okay. Okay. Now the thing with the bird flu is that it is a viral infection, uh, which you can avoid by making sure that you clean your hands very nicely after handling the eggs and the poultry, and you cook it very nicely, uh, because the viruses are in any case all destroyed by heat. But if your hygiene and handling is not so good, then it isn't a very good idea. In India, most of the poultry and eggs are available are grown on factory farms. And in these factory farms, they give a lot of hormones to the poultry and the eggs, which then stay both in the poultry and the eggs. So when you take them, they can cause hormonal problems. They can cause cancer of the breast, cancer of the uterus, and of the prostate gland. So if you're going to have these, make sure your quantities are small enough. If you're eating quite a lot of them, you're placing yourself at risk. They also tend to contain antibiotics, which affect the normal bacteria which live in your intestine. And these intestinal bacteria make a lot of the hormones which you need for normal activity. So taking these on an ongoing basis can definitely cause you intestinal issues.
Karthik, I know you had some questions for Doc as well. Huh? There's one more from Sharad. How is RTMS helping in brain health?
I don't know what that is. Can you expand that a bit? So what is RTMS?
Sharad, if you can expand that on a question, we'll ask Dr. Manik that. Karthika, you want to ask the other set of questions from Dr. Manik?
Yeah, absolutely. Thanks, Lavi. So, Dr. Manik, it's interesting because you spoke a little bit about breast cancer, prostate cancer, and uterus cancer. So, if someone is diagnosed with cancer, what advice would you give them from a dietary and lifestyle perspective?
I would say find the cause, treat the cause.
So should they continue to sort of, if they eat dairy and if they sort of high fat show again, there's no sort of broad prescription. Is that what you're saying, Doc?
Now, see, one has to individualize the answer for each individual. Okay. There are no easy answers. Okay. Now, for example, cancer tends to grow in areas where the circulation and oxygen is lower. So, one thing which is worthwhile doing is to improve the circulation and oxygenation in the area where you have the cancer. Now, the cancer cells are formed in every human being every single day. Now, when your immune system is weak, that cancer can get established. So, anything which attacks your immune system has the chance and the potential to allow the cancer cells being formed every day to grow and multiply. So, cancer is something which can be treated if you can identify and tackle the root causes which caused it.
So just gobbling whole bunches of broccoli as soon as you get a diagnosis of cancer is not going to help. You got to follow sort of the advice you get. I know, Karthika, you had a question? Follow up?
Yeah. So yeah, I actually have a more generic, broader question, because Dr. Manik was talking about how diet has to be individualized to every person. We also have a bunch of doctors who are advocating to say that generally, if you follow a whole food, plant-based diet, that's good for you. Is that a reasonable sort of assumption? I think Dr. Manik's frozen again. You're on mute, Lavi. You're on mute.
Yeah, I know. I think we may have continued power interruptions. So there was a couple more questions coming in. Would buying wheat as a grain getting into anti-help gluten allergy is a GMO to blame? Okay, so we can put that up for Dr. Manik when he gets back to us.
No, you can ask him the whole food plant-based diet question.
We'll get the answer to that one, and then we'll get the answer to the gluten one. And I know we got plenty of questions. So guys who are listening, please keep sending the questions in, and hopefully when Dr. Manik resolves his situation, at least we can definitely have these questions put to him. So please have the questions. These are great questions coming, and we'll hopefully allow Dr. Manik to indulge us a little bit today and answer the questions. I think he's back. Hi, Doc. Good to have you back. So Karthika is eager for your response to a question on whole food plant-based diet, because we've had some physicians on the show who advocate that as a panacea to a lot of ills that we suffer. I think.
Okay, see. So if a plant-based diet was the only answer, vegetarians then should not get cancer.
Well, the dairy part. So they were talking about excluding dairy. Oh, I think we lost Doc again. This is a little frustrating for Doc, I'm sure, as well as us, but appreciate everybody's patience. So Karthika, you're going to keep asking Doc that question to get clarity. Meanwhile, we got a couple of questions, I think. That one on wheat. I think he's back.
Yeah.
All right, Doc. Sorry. So, Doc, the advocates of this were also saying no dairy. So it was completely
no animal products whatsoever.
Yeah, correct.
Okay, if that were true, then the vegetarians would not get cancer at all.
Okay. Well, what about the dairy part, Doc?
Okay, see. Okay, the issue with the dairy is that dairy does cause a lot of problems. I generally do advise a plant-based diet for everybody. It's generally much healthier. It's lower down the food chain, so tends to accumulate fewer amount of toxins, etc. Now, if you're spraying pesticide on the grass you feed your cow, okay, the cow is going to concentrate those pesticides both in its flesh and its milk. So when you have that, you're going to get greater amounts of greater amount of the pesticides in the food. Okay, so when we have a look at it, that even people who are purely on plant-based diets do still get problems because the issues are still there. I am, of course, in favor of a plant-based diet, but I do not think that it is the answer to everything. Any answer needs to be individualized for each and every person. And there is no general answer which applies across the board.
Okay. All right. Karthika, we had a question from the audience also on the wheat, right?
Yeah. Okay. 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 The thing is that if you have a gluten allergy, then you have to stay off the wheat at least for 4 to 5 years. Okay. Okay. Now, if you're buying the same wheat and you find it at home, there is no way for you to take out the pesticides which are already incorporated inside the wheat grain during the process of growth. So, since you have a gluten allergy, you don't have an option. You just have to stay off it for 4 or 5 years, and then you can cautiously have a try to see whether you're okay or not. And at that time, you should try only organically grown wheat. Okay, buying the wheat and grinding it yourself is not going to achieve anything. Thandani has to say that vegetarians are not plant based, but there are a lot of vegetarians who are entirely plant based as well. Okay, the consumption of milk in India has increased exponentially over the last 18-20 years. I recollect when I was a child that most people in this country did not actually drink milk. It was the affluent who could afford it, but most vegetarians in this country some time ago could not afford milk and would not actually have milk. Okay, so that's the answer to that one. And Denise asked. Huh?
Okay,
Yeah.
Karthika?
Yeah, thanks, Dr. Manik. What advice would you give somebody who was diagnosed with COVID-19?
Okay. Okay, so COVID-19 is something which generally cures itself. Okay. Okay. Now, all you have to do is to maintain your immunity. Keep an eye on the fever, on the heart rate, on the SpO2. If the oxygen is falling, then you may need supplementary oxygen. But basically, COVID-19 is something which cures itself in large numbers of people. Good nutrition, ensuring that you're getting enough of vitamin C and D, is undoubtedly helpful. If you're having a tendency to blood clots, then undoubtedly aspirin is something which is helpful as well. But most cases of COVID-19 will actually cure themselves without any active treatment.
Okay, I think
Audience question. If I have gluten allergy, can I consume wheatgrass or barley?
No, ideally not, because they both contain gluten.
okay. All right, that answers that. But there are plenty of alternatives now, isn't it, doctor, for people who have allergy to gluten? I mean, there's obviously our ancient grains that are very good.
Absolutely. Even with the ancient grains, my advice would be that try and get them organically if you can, because a lot of the ancient grains now are also being grown with pesticides. And like in Delhi, you have the Pusa Institute, and all over the country, you have places where they are actually growing hybrids of all of these, which do need pesticides and fertilizers. So just because it's called an ancient grain, it doesn't mean it's necessarily healthy or safe. Try and get organic for all grains and vegetables and food as far as you can.
And Doctor, that's primarily because you're concerned about the pesticides and fertilizers and the heavy metal poisoning and other things that you can get from eating food that's not grown in a holistic and sustainable manner.
See, what's happened actually is that our environment has got very grossly contaminated at the moment. Okay. We don't have clean air, we don't have clean food, we don't have clean water. So, all of these are serious hazards to our health. Okay. Now, unfortunately, we don't seem to acknowledge that when we are doing stuff. And in our country, unfortunately, with the malaria control programs we have sprayed very toxic levels of pesticides all over our country. The water supply in most places is contaminated with acids, with industrial wastes. The air quality in NCR, where you live, is among the worst in the world. So there are health issues which apply in all of these. Okay. So in cancer, for example, one has to look and see what are the contributory causes which cause the cancer in each person. So vegans undoubtedly have a greater chance, but I have had a lot of patients who have been strictly vegan who have also got cancer due to other causes as well. Okay,
So, Doc, I know that I personally know that you're a brilliant sort of diagnostician, right? And I remember a conversation I once had with you at the clinic where I asked you about, I think there was a patient there with Parkinson's, and you made a comment that is one of the most commonly misdiagnosed things that you've seen in your practice. Can you shed some light around Parkinson's and what your experience has been with that diagnosis?
Okay. Parkinson's is usually caused by a slow virus infection. And there were epidemics which happened of this in the 1920s. And as a result, we saw a lot of cases of Parkinson's about 8 to 10 years after that. We had another epidemic in the 1950s as well, which caused quite a lot of cases in the late 1960s, the 70s. And we had an epidemic in the early 70s as well, which caused again a whole lot of cases of Parkinsonism after that. The thing with classic Parkinsonism is that it responds extremely well to drugs. But after that, we don't seem to have had an epidemic of the slow virus which affects the brain. So, in my experience, almost all the patients I've been seeing with these kind of symptoms over the last 18, 20 years have got other causes which are causing a tremor. Or they may be due to problems in the brain, they may be due to problems in their intestines. All of these are things which can happen. So I personally don't think I have seen a real case of Parkinsonism now since about the last 18 or 20 odd years. So Parkinsonism can also be caused by head injuries. I don't know, at the time when you were here, was there a gentleman with Parkinsonism here who was in a wheelchair when he came?
I think so, Doc. That was the one. Yeah.
Right. And with a little bit of cranial work and a lot of change in his food, he was able to walk after that. I think he was 78 at that time. And he was in a wheelchair at the time he came. And I spoke to his wife about 3 years ago, and she was very upset with me. She said, earlier, I used to go out, I used to go to the vegetable market and everything. Now, my husband, he walks so fast, I can't go with him. And he leaves me alone at home and he goes out every day. So I'm extremely angry. Okay. So the change over there was largely due to the change in the food and diet and some amount of cranial work as well. But it was the dietary change because the hormones, dopamine, is largely synthesized by the normal bacteria in the gut. And a lot of the neurotransmitters which allow us to maintain health are synthesized by the bacteria which live inside the intestines.
Just so that I understand what you just said, right? So if somebody tomorrow gets a diagnosis of Parkinson's anywhere in the world, what you're suggesting is that potentially could be a misdiagnosis? I mean, that's pretty
I would imagine so.
Wow.
The easy way to make out is there are these anti-Parkinsonism drugs. If you administer it to the person within 45 minutes, they are back to normal.
Okay. And that means what?
That means you have Parkinsonism.
Okay. So if you're
not getting a full response,
okay,
and you're not going back to normal, you should look at it. Is my diagnosis all right or not?
I see.
Because there are areas of the brain called the basal ganglia, which is attacked by the slow virus in Parkinson's. But other problems in that area can cause similar symptoms. So it's worthwhile to have a look and find out why.
Understood.
Okay, because unless you know why, any treatment you do is unscientific.
And the same applies to MS. I think that's another. I've actually personally witnessed a patient in your clinic with MS doing remarkably well. What's the story there?
Okay. So the thing is that if you know why, then the treatment flows from that. So in that case, uh, for each person, I figured out why, and from the why will flow the treatment. There is no standard answer. Now, Sharad was asking, he's asking a question about, okay, I think he's saying the repeated transcranial magnetic stimulation can also be very helpful, because what happens is that the cells in the body have a potential difference between the inside and the outside of the cell. In a healthy person, this is minus 60 millivolts. Okay. Now, in a person who is not healthy, this starts to fall. So it goes to minus 50, minus 40. And when it goes down anything lower than that, it seriously affects the functioning. So transcranial magnetic stimulation can raise the potential between the inside and the outside of the cell. This potential difference between the inside and the outside of the cell allows the nutrients to enter the cell. There is something called the sodium potassium pump, which, as it works, carries the nutrients into the cell and the waste products out. So, in unhealthy cells, the functioning is affected. So, when we do transcranial magnetic stimulation, either using pulsed electromagnetic frequency treatments, you can actually normalize the functioning of the brain. But again, what I said is one needs to first find the cause and treat the cause. Otherwise, the symptom may go away but will appear again unless you tackle the underlying root causes.
Okay, Karthika, more questions I know for Doc?
No, nothing from the audience.
Oh, you. Yeah, your questions I know.
Yeah, I have one question with regard to this whole COVID long haulers thing that has come up where people have protracted symptoms. Would that, do you think, in your opinion, in 10 years' time have more long-term effects like other diseases such as Parkinson's?
See, the thing is that a lot of these things do happen. Okay. And when they do happen, we have to be careful about it to say that why did it happen? It's not only the effect of the COVID. It often has a lot of pre-existing other issues as well. And these pre-existing issues are something we must also learn to handle. Okay, because if we don't handle those, you're going to keep getting the same symptoms again and again. Okay, so and I've been treating a fair amount of COVID actually. I've been treating a fair amount of that. And I have seen in my experience that if we find again and tackle the underlying causes, we can help them out of it. Now, unfortunately, it seems that we have about 118 million odd people worldwide who have had COVID so far. We have lost about 2.5 million people, and there are about 7.5 million people worldwide who are suffering from the effects of the long COVID. These symptoms which they have can be a shortness of breath, exhaustion, fatigue, brain fog, joint pains, a lack of appetite. All of these are symptoms which can happen. One of the problems I have been finding in some of the patients I've been treating is that they have become quite anemic as a result of some of the issues with the blood which took place during the COVID. And one needs to identify if they are anemic and to check their iron levels. And if they are low, one needs to bring them back. In those people who are unable to be able to actually breathe too well, I teach them Gyan Yoga. Gyan Yoga is a form of yoga which I have been experimenting and working with for the last 20 years. And it's a very scientific and a very old form of yoga, where you use the yoga to understand what is going on with you, and you use the yoga to help the person to heal. And I have seen that in general that most of the patients I treat seem to be able to clear up the effects of the long COVID in about 75 odd days.
Wow, that's really good, doc. So the long haulers have some options with Gyan yoga and proper nutrition
Yeah.
as well.
So what I
Um,
ideally do with them is I first ask them to have a consultation with me online. We look at their iris and we figure out why they have the symptoms which they have. And then I work out an individualized program for each person.
So I think we were going to ask Doc this question, which was you mentioned Iridology once before, and you just mentioned Iris again. I personally experienced your Iridology, so I'm going to ask this question. So what is Iridology, and how is it sort of a diagnostic tool for you that you use so very well? And I know maybe a lot of people in the audience probably have never heard of Iridology and probably are frantically Googling this as we speak. But
Okay,
Doc, if you could illuminate.
I'll just show you a chart in a minute, which gives you an idea. Now, iridology is a very old Indian science. Okay, Thetra Pariksha was the way it was called in Ayurveda. Then Thetra means the eyes. Okay, Pariksha means to examine. So
Netra Pariksha.
Netra Pariksha is a very old method of diagnosis, which has been used in India for at least for maybe 4,000 to 5,000 years. Do you think I can screen share here? Let me see if I can.
Yeah, you can. There's a little
Okay, I'm just
icon
pressing
of-
that. Let's see. Let me just see if I can find it. Just 1 second.
Ravi, you're on mute. Ravi?
Okay.
Sorry. Yeah, thank you. Doctor, so I think Netra Pariksha in the old days was probably somebody peering into your iris, right?
Yeah,
or your eye.
Yeah, that's right.
And today you use some modern technology to do that. And from a remote perspective, you can do that with a well illuminated smartphone.
Alert from system preferences. Google Chrome will not be able to record the contents of your screen until it is quit.
I don't know what that was. Okay.
Okay, sorry. Okay.
Go ahead, Doctor. Can you share the screen or not?
If you want me to share the screen, I'll have to leave the call and appear again. Is that okay with you? Should I leave and appear again? Or should we just
okay,
continue?
if it's going to really make a big difference, we could entertain that. That's not a problem, Doc. Go ahead.
Okay, fine. Let's do screen share then. Okay, got it. Are you able to see my screen? No, not really. Okay.
No, not yet.
Okay.
There we go.
Sorry, that's not the one I want. Sorry, let's see. Oops. Let's stop that and see. I thought I had the screen open actually. What happened to it? Okay, this is what I want to share. Application window. Okay, go. For some reason, it's not allowing me to bring up the screen for whatever reason. I can't see it. Maybe I need to close some of these things. Okay. Okay, seems sorry, I can't do it easily.
Okay, no problem. Can you talk to it, Doc?
Oh, yeah. Okay, so the iris of the eye has a reflection of the health of each part of the body. You have the brain at the top of the iris and the feet at the lower portion. And all the organs are spread around the iris of the eye. So from the eye, we can get a very quick and an accurate overview of what is going on with each individual. So for most of us, we seem to think that the eyes are just brown or green or black or whatever. But actually, there's a hell of a lot of information available from there. And if you recollect what Shakespeare said, the eyes are the mirror of the soul. And I have seen that's actually something which is really true. Because from the iris, we can get a very good idea of what is going on with each person. What are they thinking about? Are they stressed? Which are the things they are likely to be stressed about? Which organs are weak? Which organs are strong? Which are the organs where you are likely to get problems? Which are the food allergies? So it gives us a very quick overview of what is going on with the person. So I use that as one of my primary means of diagnosing as to what is the issue with each patient. I will, of course, always ask them the history first. I look at their iris, I examine them, I may ask for the lab tests. But by using all of this, I'm able to find a reasonable amount of things to put together the pieces of the jigsaw to help each person to figure out the reasons as to why they are ill.
Okay.
And a lot of people actually consult me simply to find out as to how things are going to go and how to stop them from happening. So, about 80% of the patients I see, I usually see only once actually, because I'm able to get an overview and I say, these are the problems you're likely to have, these are the reasons why you're likely to have them, these are the weak areas, these are the strong areas. And I tell them, please do all these things, and maybe after 4 or 5 years, please see me again.
So the Iridology gives you a diagnostic of current issues as well as indicator or predictor of
Of the
future
past
problems that
and
may come about.
of the past and the future both.
Okay, fabulous. Kartika?
Sorry, I'm all good, Lavi. I think the audience questions have also sort of started to run
Okay.
out.
Dr. Mani, if you can indulge us for 5 more minutes, we can ask a sort of final set of questions from you. So this is sort of a sort of a two-part question from me. So I know that you've drawn a very sort of clear, or you advocate sort of this connection between the mind and the body, right? For wellness.
Yeah.
And I think the other part is that you also unusually for a physician link spirituality with health and wellness as well. Right. So maybe a little bit of explanation, understanding around why all three of those components are vital for human health would be useful.
You are a human being who consists of all of these: the body, the mind, the emotions, the soul. All of these are an integral part of you, right? Now, if you don't have a soul, the body is not able to work. It is the soul which gives life to the body, which it uses for its journey on earth. The mind is a tool which the soul uses for you to interact with the world around you. All of these need to be healthy and in sync for you to achieve your objectives in this life. Okay. Unfortunately, we cannot separate the three. The human mind likes to break down things into small pieces, which are then understandable and can be categorized. One of the things I have found is that the human mind categorizes everything. It puts a label and puts it into a small box somewhere. Once you put things into a box, you are incapable of understanding or thinking about it after that. Okay. Now, a lot of problems which arise with the mind arise because they are in a box which is not adequate for you to explain or understand it. The soul is what gives life to you. The soul is what has brought you here. The soul is what is using you for its journey. So, by being able to understand and experience your soul, you will have the harmony between the body, the mind, and the soul. There are a lot of people who say we are unhappy, we are depressed. So, what does that mean? It means that you are not doing what your soul wants you to do. A depressed person is unhappy. Happiness is one of the things which comes from your soul. When you don't want anything, when you're happy, you are content, you're peaceful, at that time, you are experiencing your soul. Your soul is happiness, peace, love. These are the things which all of us strive for. All the actions we do, the jobs we do, the relationships we form, the company we seek, all of these are a search for the happiness which lies inside you itself. When we seek these things outside, we are invariably not able to find it, because these things lie inside you, and it requires you to turn yourself inwards. And in the inwards journey, you will find everything which you always wanted. You cannot find these things in the world outside. In my experience, quite a lot of the people who I see and have seen over the years have come to me with the problems of the body and the mind. And these have then become tools for them to start to understand who they really are, the Atma, the soul. And in it itself, your access to God, to the universe, to the energy around you. And any talk about health has actually to address each one of these three aspects: the body, the mind, and the soul. So when I've talked of integrated medicine over the years, it's actually because through my efforts, I have attempted to integrate and let each person experience the wholeness which they have and who they really are.
Thank you so much, Doc. I think on that note, which is a perfect ending to what has been a wide-ranging and interesting, fascinating conversation. I hope I've had the honor and the privilege to have many of these conversations with you over the years. And I'm grateful that you agreed to come on the show and share some of that wisdom with our global audience, Doctor. So thank you very much from both a perspective of a friend as well as host at Pandemic Punditry. Karthika, any last words for Doc?
I mean, obviously, I loved everything that Dr. Manik has said up to now, but the last bit that he talked about, the mind, body, and the soul, and how the soul is just using our body for its journey, that really resonated with me. So thank you.
So thank you so much again, Doc, for all that you do and for gracing the show. And if anybody wants to get in touch with Doc, Karthika, we put the link up there.
Yeah, we'll put it when I release the.
We'll put it on the thing as well. So it's, I think, www.drmanik.net. So thank you so much, Doc, and all the best to you, and hope to see you soon. Thank you.
All the best. Take care. Thank you.
Thanks, Doc.